Welcome to this unique training which will focus on the opportunities you have in store to support your type 2 diabetic customers. The aim is helping these customers to better manage the chronic condition in which they live with. Together, we can help these customers with some knowledge that there are products available within the Tony Ferguson range to help them lose weight. Coinciding with National Diabetes Week in July, we will look at some great ways you can further concrete your position as a trusted health professional offering solutions and support for your type 2 diabetic customers. Pharmacists remain some of the most trusted professionals in our country, with consumers trusting your ability to guide them toward a health solution for their medical needs. During July, we'd like to work as closely as possible with as many pharmacists to offer your customers an opportunity to try one of the very products that just may assist them to better manage their type 2 diabetes, as well as create a better awareness of what's available. We are all very aware of the growing rate of diabetes globally, and if diabetes was a country, it would in fact be the world's third largest. But in our country alone, 280 Australians develop this condition every day, with 85% of these being type 2 diabetics. Branded as the epidemic of the 21st century and the biggest challenge confronting our health system, diabetes affects around 1.7 million Australians a year. This includes all types of diagnosed type 2, as well as the 500,000 people who we believe are living with the condition undiagnosed. Diabetes is the fastest growing chronic condition in our country, increasing at a faster rate than other chronic diseases such as heart disease and cancer. This epidemic is costing our country an estimated $14.6 billion a year. What we do know for sure is that many cases of type 2 diabetes can be prevented or the onset delayed through positive lifestyle changes. Tony Ferguson now has very different program options to suit all our different types of customers. But we have one in particular in which research has shown can be safe and effective for type 2 diabetics. VLCD stands for Very Low Calorie Diet, which is used to enable rapid weight loss. A VLCD regime is followed for up to 12 weeks, usually under medical supervision. Weight loss using a VLCD is associated with a reduction in blood glucose levels, total cholesterol, as well as blood pressure. Some other benefits of using VLCDs can include the motivating effect of rapid weight loss, appetite suppression from mild ketosis, preservation of lean body mass as a result of the protein content of the VLCDs, as well as the convenience factor. Calorie intake on a VLCD program varies, but is usually between 450 to 800 calories a day, with at least 50 grams of protein, as well as essential fatty acids, vitamins and minerals. Achieving such a low calorie intake while meeting nutrient targets is not easily done through diet alone, so a VLCD program usually enlists the use of a VLCD meal replacement, such as the Tony Ferguson VLCD shakes. You would usually consume 3 or more of these per day, coupled with low-calorie vegetables, a small amount of essential fats, and a piece of fruit. A more detailed training is available online in the consultant section of the Tony Ferguson website. Research looking at VLCDs and type 2 diabetes has shown that following a 12-week VLCD weight loss program under medical supervision is safe and effective and will assist you with weight loss. And losing weight can result in improvement in blood glucose levels and fasting insulin, improvement in HbA1c levels, as well as greater weight and waist circumference loss than that of a standard weight loss program. We'd like to share these facts with as many type 2 diabetics as possible throughout July with your support. We're hopeful to raise awareness of the benefits of the VLCD and weight loss and assist some of your customers to make a lifestyle modification which may help them better manage their condition. Whilst there is currently no cure for type 2 diabetes, we do know the condition can be managed through lifestyle modification, medication, and better awareness. Any dietary changes can affect your customer's medical condition. For this reason, it's important to advise your customers to seek medical advice before beginning the VLCD program. It's also important to note the VLCD program is not suitable for anyone over the age of 65 or anyone with a BMI less than 30. During National Diabetes Week from July 10th to 16th, we'd like to offer every customer in-store who has their script filled for their type 2 diabetic medication a free sample and information flyer to better educate them on the benefits of losing weight this way. This also presents a great opportunity to offer these customers some of the in-store services around type 2 diabetes, such as blood glucose monitoring, along with the standard weight checks, which we should be already offering. These checks can be offered as you and your customers see fit. However, if any concerns are raised during these checks, you can direct the customer back to their GP for further advice. There will be more detailed information on the flyer for the customer, and for you in store, the Diabetes Week Campaign Essentials, which you will receive in June, will also provide suggestions on making this one of the best VLCD promotions yet. For any questions, please feel free to contact either myself, Jacinta, or Emily. We are very committed to the success of this promotion and are happy to help you in any way that we can.